The story of growth hormone has been told and retold countless times, but never has the moral been so clear as in Jack and the Beanstalk, a classic tale of plucky determination, character growth, both pre and post growth plate fusion, that is, and gigantism, of course. You see, Jack was supposed to sell the dried up family dairy cow, but he ran into a mysterious old homeless man who offered him magic beans instead. So he did what any of us would have done in the same situation. Magic. But these aren't just any magic beans. These beans contain the enchanted ingredient, growth hormone, and they were picked from the forest of a far-off land known as the anterior pituitary. Okay, look, just stay with me here, okay? It gets better. Anyways, the old man promised that growth hormone was required in childhood and adolescence for attainment of normal adult size and proper lean body mass and bone density. This sounded very appealing to Jack as he looked down at his pudgy and underdeveloped boyish physique, so he made the trade. This enraged his mother, of course, and she threw the beans out the window, at which point they promptly grew into a vine that stretched to the land of the giants. We all know the rest of the story, of course. Fee-fi-fo-fum, angry giant guy, time to chop down this whole operation. In this sketch, those magic growing beans represent growth hormone, and its recombinant form, somatotropin. Growth hormone is a peptide secreted from the anterior pituitary along with prolactin, a peptide hormone with significant homology to growth hormone. And if you look closely, you'll notice that the magic growing beans are spilling out of the front of a burlap sac that looks almost like the anterior of the pituitary gland. After growth hormone is released by the anterior pituitary, it enters the circulation and diffuses into tissues, where it binds to the growth hormone receptor on target cells. At the surface of the cell, growth hormone dimerizes two growth hormone receptors, triggering a cascade of intracellular signals mediated by the receptor-associated JAK tyrosine kinase and signaling molecules called STATs. Think of it as the JAK-STAT pathway, just one of the pathways that growth hormone initiates. Check out the tire swing in front of Jack's house. It's just like in front of that insulin gingerbread house. A tire swing is our recurring symbol for receptors linked to a tyrosine kinase. Yes, I know, in the original story, Jack's full name was Jack Spriggans, but in this version of the tale, he's known as Jack Stat. Just think of jacking up that cell growth. Here's the thing, though. When you think of growth hormone, the first thing that comes to mind is growth, right? Well, it turns out that growth hormone exerts numerous effects on body composition, as well as carbohydrate, protein, and lipid metabolism. The growth-promoting effects, however, are mainly mediated through an increase in the production of insulin-like growth factor 1, or IGF-1. It's insulin-like because it looks like insulin. It activates a receptor tyrosine kinase just like insulin, and it even acts a little like insulin. So we've included our recurring symbol for insulin, a welcome inside mat. We use this symbol because insulin is the main anabolic and storage hormone of the body, bringing sugar and fat inside cells. This time, however, the mat is getting lifted into the air by one of the magic growing bean sprouts, because this is not insulin, but a growth factor, an insulin-like growth factor. IGF-1 is responsible for promoting long bone growth. Hence, a lot of IGF can be found circulating around during the pubertal growth spurt. Just think of a child's height shooting up, just like this vine lifting the IGF mat off the ground. Much of this circulating hormone is produced in the liver, so notice that the growing vine erupts from that liver-shaped rock. Alright, so think of IGF as the hormone that helps you sprout up and grow in height. Growth hormone, on the other hand, is largely responsible for exerting a variety of metabolic effects. Think of it as the hormone that helps you bulk up and gain more lean muscle mass. So attached to the massive bulked up vine, we've designed one of the leaves to depict striated muscle. Growth hormone exerts anabolic effects in muscle, while it has catabolic effects in adipose cells, shifting the balance of body mass to an increase in muscle mass and a reduction in adiposity. Just think of our recurring triglyceride-ridden donut jar toppling over, evoking an image of some major adipocyte lipolysis. Across the land, word of Jackstadt's beanstalk spread, and townspeople traveled from far and wide to witness the spectacle firsthand. Among the visitors, we're going to illustrate a few clinical scenarios when growth hormone can be administered exogenously for treatment. Growth hormone is given to improve growth, of course. However, the greatest improvement in growth occurs in patients with growth hormone deficiency. See this stunted kid here holding one of the famed growth hormone beans? He depicts the short stature of a child with growth hormone deficiency. A deficiency in growth hormone can be caused by numerous mechanisms, including genetic, developmental, or acquired by pituitary trauma or intracranial tumors, infection, or radiation. Diagnosis is made by abnormal height velocity and abnormal serum GH levels following provocative testing. If therapy with growth hormone is initiated at an early age, many children will achieve a normal adult height. You'll be just fine there, cute little stunted kid. GH hormone is also approved for children with idiopathic short stature, when there is no identifiable cause of stunted growth, though this use is more controversial, not to mention ridiculously expensive. Alright, although the greatest improvement in growth occurs in patients with growth hormone deficiency, exogenous growth hormone has some effect on height in children with short stature caused by other conditions. This includes Prader-Willi syndrome, an autosomal dominant genetic disease associated with growth failure, obesity, and carbohydrate intolerance. Prader-Willi will be symbolized by Padre Willi here. It fits quite well, actually, because Prader-Willi is caused by a missing piece of chromosome donated by the father, hence Father Willi. In children with Prader-Willi and growth failure, growth hormone treatment decreases body fat and increases lean muscle mass and linear growth. Growth hormone treatment is also useful for increasing the final height of girls with Turner syndrome. Just think of this girl here turning a cartwheel. Again, the imagery is perfect because Turner syndrome is caused by the transmittance of a single X chromosome, resulting in an XO genotype, just like the single X she's making during that cartwheel. Remember that all these growth effects are mediated by growth hormone's ability to increase levels of IGF. So a small number of children have growth failure not due to growth hormone deficiency, but due to a severe IGF-1 deficiency. These patients will not be responsive to exogenous growth hormone administration. Mecasermin is a recombinant form of IGF-1 that can be used in these patients. Just think of the emergency sermon here being announced at Padre Willi's church, in light of all these strange and unnatural events. To remind you that Mecasermin is a recombinant form of IGF, we've incorporated the sermon sign in front of another one of those growing bean sprouts lifting up that insulin-like mat in front of the church. In patients who are unable to respond to growth hormone because of severe resistance, which can be caused by growth hormone receptor mutations or anti-growth hormone antibodies, the administration of recombinant IGF-1 can be used instead. Remember though, insulin-like growth factor is insulin-like, so it may cause hypoglycemia. Turns out that when you just give growth hormone instead, it doesn't really have much of an effect on glucose levels, because growth hormone actually reduces insulin sensitivity, while IGF, upregulated by growth hormone, exerts insulin-like effects, so it balances out. Whoa! Okay, here comes the giant himself. What did Jackstadt do this time? Alright, I think I'm going to have to agree with Padre Willi on this one. All this growth is getting a little out of hand. Let's see what we can do to block the effects of growth hormone instead. Growth hormone antagonists are used to reverse the effects of excess serum growth hormone, which is usually caused by a growth hormone secreting tumor of the anterior pituitary. These hormone-secreting pituitary adenomas are usually seen in adults after the fusion of growth plates. This means that all the extra growth hormone won't be able to cause long bone growth. Instead, it causes acromegaly, a syndrome characterized by a deep voice, large hands and feet, coarse facial features, impaired glucose tolerance or insulin resistance, and increased risk of colorectal cancer or polyps. When a growth hormone secreting tumor occurs in children before long bone growth plates close, It can cause increased height and gigantism, and it looks like our big, not-so-friendly giant is approaching quickly, so it's time to act fast. The initial therapy of choice for a growth hormone-secreting pituitary adenoma is transsphenoidal resection. Medical therapy with growth hormone antagonists is introduced if growth hormone hypersecretion persists after surgery. Octreotide is a synthetic analog of somatostatin that acts on somatostatin receptors to inhibit the secretion of many hormones, including growth hormone. And so we've sketched in Jackstat's mom here, who rushes over to warn the townspeople of dangerous amounts of growth hormone coming down that vine. The octagon shape of the stop sign should remind you of octreotide. Not only that, octreotide is a synthetic polypeptide with effects similar to somatostatin. So just think of that somatostatin stop sign bringing a halt to all that hormone secretion. Somatostatin is an endogenous peptide that plays a key role in numerous regulatory processes throughout the body. In other words, it's that hormone that stops stuff. It reduces intestinal and pancreatic secretion, slows GI motility, and inhibits some pituitary hormones. Recall from our relaxatives sketch that we also discussed ways to combat diarrhea. Specifically, we illustrated how octreotide is effective in combating numerous causes of secretory diarrhea. See the cancer crab shape incorporated into the sign? It's our recurring sketchy symbol for cancer, or really any kind of tumor. So let the words VIP and customers stand for VIPoma and carcinoid tumor, respectively. Carcinoid syndrome is usually characterized by an ileal tumor with hepatic metastasis that is secreting a number of biologically active substances, including serotonin. VIPomas are pancreatic endocrine tumors that secrete vasoactive intestinal peptide. Both of these conditions involve hormone-secreting tumors that cause systemic symptoms, including flushing, wheezing, and a secretory diarrhea. For patients with advanced symptomatic tumors that cannot be completely resected, octreotide can be used to reduce secretory diarrhea and systemic symptoms through inhibition of hormonal secretion. Why is that sign really there? Well, it turns out that Jack and his mom are running some kind of racket where they let special customers pay to climb on the beanstalk. What? I'd say there's probably some kind of lesson to be learned from all this greed, but if you've read the ending already, seriously, it's like there really is no moral. Stealing stuff is fine, just make sure that you murder the person who caught you, and then you'll be able to live happily ever after with all your stolen stuff. Anyways, octreotide's ability to inhibit the secretion of numerous hormones and transmitters makes it an ideal drug for counteracting the systemic effects of all kinds of hormone-secreting endocrine tumors. For example, octreotide is used to reverse the effects of insulinoma. Just think of our recurring insulin welcome inside mat, but really big, to welcome a giant. The characteristic clinical manifestation of an insulinoma is fasting hypoglycemia. Octreotide can also reverse the effects of glucagonoma. At Sketchy, glucagon is represented by sweetener packets, because glucagon is responsible for gluconeogenesis, glycogenolysis, processes that normally increase your blood sugar. A glucagonoma then is a ridiculously huge sweetener packet for a giant cup of tea. Glucagonoma syndrome usually manifests as weight loss and a necrolytic migratory erythema, a characteristic skin eruption of red patches with irregular borders, intact and ruptured vesicles, and crust formation. It commonly affects the limbs and skin surrounding the lips. Octreotide therapy also reduces symptoms of gastrinoma. All this gastrin causes Zollinger-Ellison syndrome, characterized by abnormal gastric acid secretion. Check out our PPI Sketchy Farm video for more info on this huge gastrin gas tank and how it can lead to so much acid secretion. Turns out octreotide is also useful for the acute control of bleeding from esophageal varices. Just think of these exposed variceal venous pipes, unearthed by the growing vine and ready to burst. Esophageal varices can develop when too much pressure builds up in your portal system. This portal hypertension can occur as a consequence of chronic liver disease. In patients with cirrhosis and portal hypertension, somatostatin reduces portal blood flow and variceal pressure, although the mechanism is poorly understood. Nevertheless, somatostatin is effective in promoting initial homeostasis from bleeding esophageal varices. The side effects of octreotide includes nausea, vomiting, abdominal cramps, and steatorrhea, all depicted by this townsperson here, who's not only horrified by the sight of the giant, but a little nauseated as well. To remember the side effects of octreotide, just think of all the stuff it can stop. Impaired pancreatic secretion may cause steatorrhea, which can lead to fat-soluble vitamin deficiency. Yellow fatty stools are depicted by this yellow fatty stool, of course. Alterations in GI motility cause nausea, abdominal pain, flatulence, diarrhea, and inhibition of gallbladder contractility causes formation of sludge or gallstones, which rarely results in acute cholecystitis. Wait, here's one of our VIP customers now, climbing down the beanstalk and making a narrow escape. Okay, all of a sudden I'm rooting for the giant here. He was stealing his stuff. Do you really need a talking harp lady friend? The burglar represents cabergoline, of course, and the broomstick, well, that's bromocriptine, my friend. Both are agonists at the D2 dopamine receptor. Hence our recurring symbol for the D2 receptor, 2 parallel dope ropes, this time incorporated into a rope ladder. Dopamine agonists suppress a few pituitary hormones. These agents cause potent inhibition of prolactin release, useful in patients with hyperprolactinemia. Dopamine agonists can also be used to reduce growth hormone release in patients with acromegaly, although not as effectively. To emphasize inhibited release of growth hormone, we've included a pituitary sac at the end of this bromocriptine broomstick, holding in those magic growth hormone beans. Besides inhibiting the release of growth hormone, however, we can also directly inhibit its receptor. Enter Pegvisomant, a growth hormone receptor antagonist used to treat acromegaly. This is that tyrosine kinase-associated receptor, remember? So just think of this Pegvisomant ant here, blocking that magic growth hormone bean from reaching the tyrosine tire swing. Pegvisomant inhibits receptor activation, remember, not growth hormone secretion. It may actually lead to increased growth hormone levels and adenoma growth. Yeah, so that's the end. The lesson, of course, is to make sure you have an exit strategy, which may involve murder, but that's okay. Okay.